What if one of the most private things a man does is also one of the most misunderstood, especially later in life? If you're a man over 50, you've probably wondered if masturbation is truly healthy. You might have worried in private that you could be causing some kind of invisible harm. If so, you are far from alone. This is a topic surrounded by confusion, outdated myths, and a stunning lack of clear, reliable information. After looking at the data, it's easy to see why. While a majority of men over 60 continue the practice, many are doing so in the dark, unsure of the real effects on their hormones, their prostate, or their performance with a partner. Today, we're going to have that honest, science-based conversation. We'll explore the surprising benefits and the hidden risks you need to be aware of to ensure your practice is a healthy one. Forget the gym for a moment. There's another workout that's crucial for men's health. The act of achieving an erection is a powerful physiological event. It increases blood flow into the spongy tissues of the penis, known as the corpora cavernosa. Think of it as a form of targeted physical therapy. This regular exercise helps maintain tissue elasticity, which is absolutely critical for achieving and sustaining firm erections as you age. But this internal workout does more than just maintain equipment. It protects a vital gland that men worry about constantly. Major studies from institutions like Harvard have uncovered a shocking link between ejaculation frequency and a lower risk of prostate cancer. The leading theory suggests that regular ejaculation helps flush out potentially harmful substances and secretions from the prostate ducts. It's a natural cleansing mechanism that many men are completely unaware of. While protecting you from future risks, it's also strengthening the very muscles that control your performance right now. Every orgasm is a rep for a muscle you can't see, but you definitely feel the results of. The rhythmic contractions that occur during climax engage key pelvic floor muscles, like the pubococcygeus muscle. A strong pelvic floor is vital for everything from erectile function and ejaculatory control to preventing urinary incontinence, a common and frustrating issue for aging men. And the benefits go far beyond the physical. In fact, this act is one of nature's most powerful stress killers. Imagine a single act that can wash away stress and flood your brain with the same chemicals associated with pleasure and bonding. Orgasm triggers a massive release of dopamine, the motivation and pleasure molecule, and oxytocin, often called the bonding hormone. At the same time, research has shown it leads to a significant drop in the stress hormone cortisol. This natural mood booster provides a sense of well-being that is invaluable for both mental and cardiovascular health. But this chemical release isn't the only way it keeps you safe. Your own hands might be your first line of defense in detecting serious health issues. Now, we have to talk about the other side of the coin, where a healthy act can start to hide a deeper problem. It's been said that if you stimulate yourself with the exact same intense grip and rhythm every single time, your brain can become conditioned to only that specific touch. This can make it incredibly difficult to achieve arousal or orgasm with a partner, whose touch will feel different and less intense. This disconnection isn't just physical. It can mask serious health warnings your body is trying to send you. If you can perform solo but struggle with a partner, it's not just a psychological issue. It could be a silent alarm for your health. It's tempting to ignore the issue, but this pattern can mask serious underlying health problems like heart disease, diabetes, or hormonal imbalances. If you notice this discrepancy, it is essential to see a doctor to find out what's really going on. And sometimes, the danger isn't a hidden disease, but the very way you're doing it. The position you're in could be slowly causing numbness and pelvic pain without you even realizing it. Many men practice while sitting hunched over in a hard chair, a position that can compress the pudendal nerve in the pelvis. Over time, this can lead to genital numbness, pain, and other pelvic issues. The fix is simple. Practice in a relaxed, comfortable position, like lying down with proper support. Beyond physical harm, there's a more subtle risk that has to do with your expectations of reality itself. What happens when the fantasy you watch becomes more compelling than reality? Rumors and online discussions suggest that when masturbation becomes heavily reliant on extreme or unrealistic pornography, it can skew your expectations of sex and intimacy. It can make it difficult to connect with a real-life partner because reality can't compete with the highly produced fantasies on screen. The key is to balance any visual aids with your own imagination and memories of real, effective experiences. So, after weighing the good against the bad, what's the final verdict? As you can see, masturbation after 50 isn't simply good or bad. It is a tool, and like any tool, how you use it determines its effect. Practiced with awareness, respect for your body, and moderation, it can be a powerful ally for your health and vitality. The secret to a healthy sex life in your mature years isn't about stopping or starting. It's about bringing awareness to a practice that's been in the dark for too long. It's about making it a conscious choice for your health, not an unconscious habit.